Good morning, friends. So today we'll discuss about the autonomic neuropathy occurred due to the diabetes. So diabetes is a very dreaded disease. It affects all organs and the neuropathy problems, especially autonomic neuropathy, that problems affect especially heart. That is called cardiovascular autonomic neuropathy. It is also affect peripheral artery. It is also affect genitourinary system. It is also affect our GI system. Gastric autonomic neuropathy also occurs. Patients frequently suffer from constipation, bloating. But the most important is it affects heart, and that is called cardiovascular autonomic neuropathy because of the long-standing diabetes. Whether it is controlled or uncontrolled, you will going to develop it. And the first is what will happen if you have a long-standing diabetes, then how your heart will be affected. The first thing is the heart rate. So there will be heart rate variation. Many times your heart rate will be high, and patient may develop tachycardia. The heart rate will be very high, and limited exercise tolerance. If that develops, then patient cannot do regular exercise, and patient should know what is his tolerance level, and that is very important, and that should be trained under the supervision of a doctor. How much exercise the patient should do when he develop this type of symptoms. So that is why, to prevent this, the patient need a structured tailored exercise program or training regarding yoga and physical activity. Next important topic is orthostatic hypotension. Orthostatic hypotension means the blood pressure will fall if suppose patient sitting in a chair and want to stand up, then blood pressure will fall. And how you know? If systolic blood pressure, that is the upper margin of the blood pressure, is fall by 20, or the lower blood pressure, that is diastolic blood pressure, if that falls below 10, and that is called orthostatic hypotension. And if patient develops such type of symptoms, then definitely you consult your clinician, and you, whenever you are changing your posture, do it very slowly, because these things are very commonly faced by the patients, and you can diagnose it also in your home. If you have a blood pressure machine, you can measure how much the blood pressure is occurring. Then you can know, yes, this may be the hypertension, orthostatic hypertension, and that should be taken care of, or immediately you should consult with the doctors. Then very important is your myocardial infarction or heart attack. Normally, when heart attack occurs in a non-diabetes patient, that is gradually in the morning time. But when diabetes occurs, then your sleep pattern will be get disturbed, and the heart attack, that will be silent, or that means there will be no pain, but heart attack will be occur and patient will die. And that typically occurs for diabetes patient in the evening. So that is called silent myocardial infarction, and patient should be very cautious regarding. That is why patient should be regular check his cardiovascular status or his status of the heart. And the last problem occurs because of the long-standing diabetes in heart is that is called obstructive sleep apnea. So sleep pattern will get disturbed, and patient wants to sleep, then there will be dyspnea. So patient forcefully has to get up. So that is very important problems. All these problems can get solved if you act on prevention. That is, if you can control your blood sugar in a natural way, organic way, then you can prevent all these complications due to the heart. You can take tailored yoga training or exercise training by our program. In our program, we trained in a gradual way. We trained exercise, we trained basic yoga, then advanced yoga, then kumbhak yoga. Then we will train regarding the meditation, so how you can control your breathing so that obstructive sleep apnea or heart attack, this can be prevented. And all these complications due to the neuropathy, that can be prevented. Friends, if you like the content of this video, then please share and subscribe. And if you want to join our program, that is a residential program, 5 days residential program, in which you can get a proper training, how to reverse your diabetes or how to control your blood sugar without any medicine, and the complication of the diabetes you can prevent in a natural way, in a holistic way, and heal your body by your physically, mentally. So then join our program. Thank you.